My name is DrRic Seguil.
And action. Hey, Jay had a... This is Kirk again.
Stress and investment.
And action. Hey everyone, it's DrRic. Today's Minute Clinic question comes from Ray. Ray had a question about midlife muscle. How much are we supposed to have? Is it valuable? And should we be doing it? Ray is very healthy. We're working on body mass index, but compared to the average American, he's above average. As far as individual improvement, I always say we try to make that person better by beating early death or disability. So if this is the first time you're finding me, don't forget to hit the subscribe button down below and the bell to find out when I do new videos. So what does the end result of any kind of investment, especially when it comes to exercise, would be to hopefully beat the three big diseases of the United States: heart attack, cancer, and neurodegenerative diseases. To make it easier for you, I'll just say Alzheimer's disease. So we'll take these, and I'll give you 5 reasons each for why exercise and resistance training is good and why we should get muscle. Why should we invest in muscle building and or exercise or resistance training for intervening. So heart attacks are life-changing. Most of the times nowadays, average person will be able to survive. If they don't make any changes, they'll survive the next. Usually it's a stent or balloon angioplasty. If they don't change, then usually after the second stent, a bypass is coming and you'll survive that too, but it's life-changing. So disability is terrible, and Medicare will go broke by 2023, I believe, or 2026, but technically it's broke already. That's why we're limited to 15-minute visits as doctors. But second thing would be cancer. That's life-ending, lethal disease. Third thing, neurodegenerative disorders. That's actually generational bankruptcy. I'd have to say that that's family ending, because usually due to the neurodegenerative diseases and the cognitive declines that you'll get, you're going to have, you might not remember, but as a Alzheimer's patient, but everyone in the family and or the government will be paying for your care until you die. And if it's the government, again, we're going broke already. I hear some of the best places for retirement to watch over our cognitive patients cost $3,000 to $7,000 a month. Those are nice places. That's not affordable. Medicare won't pay for that. You got to pay out of pocket. So who's got to pay for that? Family. And if family can't afford that, then you're going to have to live in the house, and you can't stay there alone. So somebody's got to pull out of the workforce and stay home. Or a kid can't go to college, they have to stay home. So you're choking off the family in a way. I mean, we do it for our parents, I'm sure, but it's family changing. So here's the 5 bullet points. We'll do them one at a time. So I consider, I think it's possible to get muscle to continue firing off. Now, just an example, I'm 56. I don't have time to invest in exercise like I did before when I was 20, but I have to because I think it makes me feel good. I know the value, and I want to beat what's coming my way. And unfortunately, cancer is very high in my family. Knock on wood, I'll be able to beat it. We don't know. I think we all as Americans have a little bit of cancer, but the question is, do those T cells that are circulating around find it or not? So anyway, I'll do my best. At least I won't have any remorse if I do get it. So I consider muscle development as resistance training, but not just lifting weights and bodybuilding. Actually, something like peripheral hard action or CrossFit. Peripheral hard action was made popular by Bob Guida back in the 60s, and it's doing alternating sets, back to back, no break, upper body, lower body in a short amount of time. Got you better cardiovascular resistance than cardio. It got you muscle resistance, beat osteoporosis, and you're done faster. That's just my opinion. Or CrossFit, which is cool too, and you can find a lot of places that have it. But if you're not trained for it, you might want to get some coaching on how to do it. So here's the 5 benefits for cardiovascular fitness as far as muscle stimulation and building up muscle or investing in exercise. Number 1, you'll lower blood pressure. When the exercise is engaged, the heart, for a short amount of time, will have to pump an excessive amount of volume to muscle and then get that muscle, the burnt up ATP, it turns into lactic acid, back to the liver, convert over to more energy, back to the muscle. So I think it lowers overall blood pressure because the heart just becomes an efficient pump. And the blood vessels outside the heart, like the arteries of the wrist, the arteries of the muscle, they all become very elastic and distensible. Distensible means you just take a lot more pressure. So you have lower blood pressure when the blood vessels can move more. Lower LDL cholesterol. All of you that follow me know that I'm vegan at this point in time. And by the way, being vegan at this point, I think I'm better and I still get a faster swell than I did in my 30s and 40s when I was doing a lot of alcohol and coffee and just, well, not behaving myself. However, I think I'm metabolically flexible, and that has to do with metabolic variability is what I call it. So I can go between veganism, I can go to a keto, which I probably will be trying sooner or later just as an experiment. I can go to paleo, I can go to... So there's a bunch of different things that I think if you're flexible and you have versatility, you can survive any environment. But bottom line is you want all cells to have at least be able to metabolize, beat the diseases, function at a high level. When they start to function at a low level, cells become senescent, and that's sometimes the age, and sometimes with the aging process, you shorten your telomeres or your DNA, and that opens up to early death, apoptosis, and other cancer possibilities. So anyway, I got off track. Lowering LDL cholesterol. When you have a good circulation, and when you're chewing up your energy packets that are being eaten, you will not develop such a high LDL. LDL is the heart attack cholesterol. You'll actually be able to develop more HDL, which is the cleanup crew of the cholesterols in the bloodstream. So I think of LDLs as the big, thick things that float around in the bloodstream, and they're sticky. And they're sticky and they're huge, and they going down the blood vessel pipe, they bounce off the sides and they deposit like a skid mark on your underwear, but they deposit stuff and they deposit crap along the lining of the blood vessel. You keep on depositing crap at the same area, the crap will get thick. When you get thick crap, or LDL, cholesterol, you stenosis, so narrow down the artery. When you have the HDL, which is the good guy, that most of us that don't exercise will have very low HDLs, you have these marbles in the bloodstream that when they hit that skid mark, they suck up that fat deposition and they pull it out of the wall into the bloodstream like a magnet, bring it back to the liver and digest it. That's why HDL is good, LDL is not so good. That's according to some literature. But I still think who you believe in, whether it's the American Heart Association or Sinatra's work, I still think it's important to use this as a metric. So if you can change the metric, you know that something is changing in your bloodstream. So I say that because the keto movement has LDL and HDL kind of all over the place as far as being accepting. Regardless, I think it's still a nice metric to get something of a snapshot before you start training and something of a snapshot maybe 3 to 6 months after to see if you're effectively changing anything. Now, whether you go up or down, that depends on your philosophy. My suggestion when I see my patients is trying to lose weight, and I usually see people that are trying to lose weight, overweight, average American. I use these as markers and we just try to move the needle a little bit. It's nice to see a metric. So you also can lower your weight when you exercise. So normally when you exercise, you build up muscle. Muscle initially is heavier than fat. So for a lot of my folks, they'll see that the scale doesn't change. The exercise reveals no change in scale, but waistline and waist to hip ratio decrease. So it actually, the muscle is heavier than fat. So when you start burning up fat and putting on muscle, your weight doesn't change for a little while, 6 to 9 months. But then after a while, because the muscle gets very efficient, those muscles are full of mitochondria. Mitochondria will burn up fat. So you just have to get to this threshold level. But don't fear not, because you might not lower weight initially, but your waist, your belt size, your dress size should drop. Your efficiency should get better, and then usually it'll kick in like gangbusters at about 9 months to 12 months. If not, won't be discouraged if your overall weight or body mass index doesn't change. If you're interested, which I'm going to be doing a video on this, you can get a DEXA scan. There's only one in Illinois, in Rockford. It tells you about your fat composition. That'll give you an exact as far as your fat. I don't think calipers are inaccurate. Bod pod is hard to get. DEXA scan, there's only one place that does it, but very accurate. So I'll be doing a video. Follow me, subscribe, like I said. However, it does lower weight. Puts on more lean muscle mass, cuts away the fat, especially the visceral fat, which is what you want to pull out. So the visceral fat is the tummy fat. So that's where you store a lot of crap if you are a high insulin secretor or insulin resistant. And body fat's a little bit different, but either way, you will lose fat, you will gain muscle, so lower weight altogether in the long run. Also, better sleep and stress tolerance. I always suggest that if you're going to be doing exercise, there's something about the endorphin effect with exercise. After exercise, people feel really good. They're just flying high. And I don't like using exercise to neutralize stress, because you have to push stress to a certain level in the gym, and then you get the endorphin response and feel good. Bulletproof to all the stressors of Monday. I'd rather have you just do 4-7-8 breath, work on guided imagery, see a psychologist to design some form of mindful practice. I think it's very important. Mindful practice is good at lowering cholesterol, can lower cholesterol, can lower blood pressure, can lower cortisol, but I'll save that for another video. But in this case, exercise will give you calm after the exercise with endorphin and enkephalin. That lasts for a short amount of time, but it'll make you feel better. And don't exercise too late at night, by the way, because I'd rather have you exercise in the morning. It stimulates testosterone, maybe stimulates your adrenals and your thyroid to work a little better in the morning. And the other problem is exercise at night might interfere with your sleep, so try not to do it too late. So those are the 5 reasons that I like to use exercise for heart disease, fighting heart disease. Now we'll go on to cancer. Again, cancer can be life-ending just because of the lethality of it. I have a patient that I'm taking care of now that was just diagnosed with glioblastoma multiforme, nasty cancer. Survivability is tough, but I don't put anybody to a pigeonhole, so I think the one that I see is going to survive. That's the way I treat it. So I throw everything into it, and hopefully they'll bite, and we won't, hopefully just with natural things like just changing metabolism, we won't interfere with the cancer guys. They won't mind, but anyway, nothing that pees me up. It just disturbs me more when I hear that the oncology dietitian said it's okay to eat anything you want, just as long as you get an appetite. Screw that. Man, we're trying to fight a disease process. So there, you can do keto, you can do fasting mimicking diet, you can do intermittent fasting, you can get off animal products, dairy products. There's so many other things to do, still imbibing other foods and not starving, more so than just say take bread, rice, and all that crappy shit. So my mom died of cancer, so I have a pet peeve for that. So anyway, cancer fighting. Number 1, with exercise and muscle building, you'll have a cleaner immune system. So when you have that burst of exercise, 3 days to 5 days a week, the blood pressure, the blood flow, the heart work great, and it cleans up the lining of the blood vessels. It gets circulation moving, gets stagnant blood out of the legs, moves the lymph tissue. It just makes your immune system functioning better. The immune system is made up of cells called T cells and B cells. So when you just have overall great perfusion, it allows the T cells to do what they have to do. When you have a whole bunch of stagnation, you don't move, your legs get swollen, you're inflamed and irritated, the inflammatory environment will make it harder for the T cells to find cancer. So that's why cancer cells, they try to disguise themselves away from the surveillance T cells by making the cancer cells look like surrounding tissue. But definitely, those cancer cells are making this microenvironment of lactic acid buildup. They're using a ton of glucose, supposedly, most of them, versus fat. So they're hiding efficiently. But they're this far from going into apoptosis and dying. So sometimes when you get those T cells to hunt better, you'll push them right over. So I think it's helpful for exercise. The problem is if you're deep into your therapy, chemo, radiation, whatever you're doing, or you're wasted, muscle wasting, it's going to be hard to start the exercise process when you're deep into the typical protocols of cancer fighting. So that's why I say, like I'm doing, beat the cancer ahead. If I wind up with cancer, hopefully I'll be able to fight it. I'm going to prepare. I won't be remiss that I didn't do what I had to do to fight. If I don't get it, that's fine. I'll work on the heart or work on the Alzheimer's. So I think it's an investment that's worth it. It also helps me beat stress. So the next thing, number 2, a less elevated glucose. So as I mentioned, cancer cells love glucose. That's the Warburg effect. Most of the cancers out there. So they're built, the theory is that cancer cells have a screwed up mitochondria. So they have them, but they're screwed up. So they have to utilize glucose. They can't really utilize fat. That's the theory with a lot of the new age cancer docs, PhDs. And I think I wouldn't toss that theory away because unfortunately we haven't really taken a dent out of cancer in the last 20 years. I think it's the morbidity has gone down by like 3% with all the things we're throwing at cancer and the new surgical techniques and the screening techniques. It's only decreased by 3%, which is not great. So I'd say using metabolism, using exercise, why not? I mean, again, it won't interfere with the protocols that you might get if you have a cancer discovered. Won't interfere with the surgery if you're going to have surgery. Debulking won't interfere with the radiation. I think it'll make you survive better and at least feel better. So I would try to get an exercise routine on a regular basis. So no, that's the thing with muscle. Muscle does not require insulin to get glucose into the cell. It actually is if you're a diabetic, you need insulin to get the glucose you just ate into the cell to be used as energy and to get it out of the bloodstream. If you can't get it into the cell and it just sits in the bloodstream, you have an elevated glucose level. And that's what type 2 diabetes usually is, or pre-diabetes. Well, when you exercise, there's a trigger that muscles put or allow glucose to get in without even having insulin. So those of you who are insulin resistant, that's type 2 diabetes, you might need a medicine or something of a dietary change to get that glucose out of the bloodstream into the cell. Well, when you exercise, you don't need that. It goes into the cell, no questions. That's what's so cool about exercise. It's a fight or flight rule that when you're running from danger, you don't need to wait for insulin to be secreted from the cells of the pancreas and then get to the cells to get the insulin combination glucose into the cell. You're just allowed to take off with those muscles into a 30-yard sprint, no insulin necessary. So less elevated glucose usually means less elevated inflammation, which usually means better. With inflammation, you have an acidic environment. Again, it sets up for losing the cancer battle. So helpful. Metabolic versatility, as I was talking about before, I'm practicing veganism at this point in time. I should say two of my supplements are non-vegetarian. So maybe I'm not a full vegan. However, I'm trying as best as possible for Bob, who had a heart attack. However, I'm feeling great now. I'm dialed in. I don't eat much. I didn't eat much before compared to the average American, but I can tolerate this. I think it's actually great. I'm thinking clearer. I'm going to get some blood tests and show you, if you follow me, how my numbers go and my CT scan. But metabolic versatility, when you exercise, again, you will be able to go between glucose, or if you're a keto person, which is really cool nowadays, you can go into fat. Regardless, the muscle, when it's fine-tuned, will be able to take anything. And it'll also help you be able to metabolize better. So I think it's important to do that, not only for the blood flow efficiency in the whole system, but also for the cell metabolism down into the mitochondria, the way the RNA works, the way the DNA reproduces. Everything is helpful. The way T cells hunt, my macrophages work. So all this, I think, is beneficial. Number 4, longer telomeres. If you follow Dean Ornish's work, when he had heart disease patients that were about to get bypass, for some reason they couldn't get bypass. It was a small case study. They went into this program, they exercised, did yoga, did biofeedback group therapy, and they practiced vegetarian low-fat diet. Well, the telomeres became longer, they found out, and they also reversed their heart disease. The majority of them didn't even need to go to bypass, which is cool. I probably should have put it up here, but the same things happen with prostate cancer in situ. So I think it does increase your telomeres, makes it, when a telomere, I should explain what a telomere is. Telomere is the end caps for your DNA. When the end caps, when you have no protection or no cap on the ends of your DNA, DNA is like an X that sits in your nucleus. Well, usually it's protected against pesticides, radiation, inflammation. But sometimes when the telomere, those end caps shorten, no more protection. That's when you turn into cancer. So exercise has been shown to increase telomere length. And I mean, there's no other thing that'll increase telomere length. So why not invest in exercise? Increased telomere length means longevity, less cancer. Lastly but not least, less inflammation, especially oxidation byproducts. So inflammation usually sets you up for, again, having that acidic environment. Usually inflammation is not only found as a cause for cancer, cardiovascular morbidity, and or Alzheimer's or neurodegenerative, but inflammation is just pain. It's just suffering. It's just injuring by getting out of bed and having a tweak to your muscle. So if you can decrease inflammation, or getting coughs and colds all the time, if you can decrease inflammation, you can be more productive with regards to fighting cancer and feeling better. Less inflammation means less infection usually less injury. So I think it all is a positive if you can get the oxidative crap out of you. You know, antioxidants help with fighting cancer. Pro-inflammatories, pro-oxidants cause cancer. So exercise, muscle, better antioxidant fighting. Everybody's taken like EGCG from green tea or a turmeric for inflammation. I think it's better to just exercise. Well, I would do that anyway. Those are both helpful for food sources, but if you actually pull in muscle, why not work that way to take care of inflammation? Last but not least, as far as the neurodegenerative disorders, which is essentially Alzheimer's, so early dementia. Some of you, most of you that have anybody in the family with diabetes type 2, well, early dementia is sometimes called diabetes type 3 because the brain cells are unresponsive to glucose insulin combinations and they don't have any fuel sources. And if you eat crappy, a bad functioning brain brings you memory issues. So, and it's growing exponentially in the United States, probably all over the world. I think half of it has to do with the longevity that we live, but if you look at places in the blue zones, Okinawa, Costa Rica, Sardinia, Icaria, Loma Linda, California, they live till 100, and there's no increase in Alzheimer's disease. In fact, India is one of the lowest countries of Alzheimer's disease in the world, and there has to be studies put together. Hopefully there will be, but it's assumed it's because of the lifestyle, maybe the turmeric, the amount of turmeric that they use. But ain't gonna hurt to do that. Yoga too, probably. So with Alzheimer's disease, what can we do? That's neurodegenerative disorder. Number one, exercise will give you better blood pressure maintenance, and better blood pressure maintenance usually with mini strokes accumulated over the course of a decade or two, starting from 50 to 70, that's 20 years. Enough mini strokes will also damage so much brain tissue that you end up having neurodegenerative disorder. You might not have Alzheimer's, but you'll be thinking the same way. So exercise lowers blood pressure. So exercise also decreases ceramide. Ceramide deposition is ceramide. Here, I put this. I use ceramide for dry skin on the surface. That's the ceramide. Hopefully you can see that ceramide. And it's a waxy substance, but on the surface, especially with dry hands, I have a video on winter itch. I'm not sure that you guys might want to watch that, but I'll put it down below. But ceramide helps with skin. It doesn't help with neurodegenerative disorders. So the less ceramide deposition when you exercise. So it just becomes more efficient. Supposedly ceramide gets deposited because of bad or screwed up metabolism resulted from the cell not being able to use glucose properly. And again, probably based on, this is more, it's evidence-based, but small studies only, based on the fact that most people don't exercise into their 60s like they're supposed to, they're overweight, so usually you'll set yourself up for a lot of ceramide. You don't want wax, you want wax on the skin, you don't want wax in the brain. It just doesn't work right. The other thing is less insulin resistance. And I called Alzheimer's diabetes type 3. And when you have diabetes type 3, when you have diabetes type 2, how do you beat it first? Exercise, diet. When you have diabetes type 3, by the time you have it, you're probably screwed. But I think there's always a way to lose weight, exercise, and diet, and then maybe some medicines. But I mean, metformin is usually the first go around, but I would I do the exercise on a regular basis, not to the point of injury, and with the guidance of somebody to dial it in. I wouldn't get you to exercise on your own. If you have an arthritic problem or a musculoskeletal disorder, get the help from a physical therapist first, or a sports medicine doctor like me, or any of us out there. But I think if you can get a sports medicine doctor that also has training with integrative medicine, you're better off. And some of the chiropractors are pretty good too. Or if you can find an athletic trainer certified with NASM, for example, that knows their nutrition, just as good. They'll watch over you and report back to me. So where was I? Less insulin resistance because you exercise. Again, the glucose gets taken out of the bloodstream into the blood cells, and into the muscle cells in particular, and muscle cells will help to lower. It's almost like a capacitor. It lowers the blood levels of glucose. Less glucose, you'll still have it accessible for energy. You won't take all the glucose out, but less glucose in the bloodstream means less stimulation to the pancreas, less insulin, less inflammation. Number 4, less cortisol spikes. Without exercise, stress brings on cortisol spiking. Not good. It's good to have a little bit of cortisol in the morning to start your day, but usually unanswered stress, that's why I always push exercise and mindful practice. Unanswered stress drives cortisol high, and it usually causes an adrenal dysfunction. And that also sets up for more inflammation and a cascade of hormones you don't want. It just sets up for chronic fight or flight, and I think chronic fight or flight is not healthy to be in all the time. Love, communing with society, meditation, yoga, Tai Chi, all nature therapy, all of them are beautiful through increasing the memory power, the talk between the frontal lobe and the temporal lobe. Temporal lobe, or hippocampus part of the brain, is where all the memories are stored. And sometimes when you don't exercise, you can't access the temporal lobe properly, and maybe you might get the frontal lobe to just do what it has to do. But sometimes when you have blood flow better, when you have regular exercise, lower blood pressure, temporal lobe, you can pull out memory from childhood and remember old names and old things that happened. So I really think it helps with reducing the adrenal insufficiency that we find in most Americans. So I put here usually love. That I think of it in a very basic way. It's either you're in parasympathetic, which is love, or you're in sympathetic response, which is fight or flight. You can't really be in both. And with the same thought, just to make it minimalized, you can either be building up muscle or building up fat. You can't be in both. That's just the way the hormones work. So I know it's very minimalistic, but it might get the point across that it's either you're in inflammation and asking for Alzheimer's, or you're in an anti-inflammatory state and beating the Alzheimer's and also beating the diseases. So I'd say exercise is a way to get that generated. Number 5 is exercise increases cerebrovascular blood flow. When you increase blood flow, you actually feed the glial cells. The glial cells are like the cleanup crew in the brain, astrocytes, glial cells. If you have better blood flow, your glial cells work better to take away inflammation and scar tissue in the brain. If you have no exercise and you eat crappy food and you smoke and you drink all the time, and you're stagnant and you're overweight and you're stressed out, you'll have a whole bunch of glial cells just changing, not responding, either attacking the neuronal cells by mistake, or not finding the cancers when they're early, or just laying down a matrix of inflammation and scar tissue. Alzheimer's disease is known to leave these pockets of inflammation, unusable, it's like scar tissue, unusable plaques that are in the brain that aren't brain tissue. And if I was to have an electric cord go from the plug or the electrical outlet to the device, and you kind of irritated the plug somewhere because you scuffed it up or tore it, or you have a dog bite it, you're not going to get the electric flow. It's not going to work. That's the way neuronal cells work. And if you can have a glial cell that cleans up all that crap, those are astrocytes and glial cells. And the glial cells also rely on energy too. So if you have a glial cell that's asking to be fed glucose or ketones properly, and they can't because your inflammation all screwed up because of all the things I mentioned before, well, they're not going to work right. And if they don't work right, no cancer surveillance, no fixing of damage, no fixing of inflammation. So these are the reasons I believe that you should be doing and investing in midlife muscle development. And how much? Well, I've got some videos that I'll post down below. I try to shoot for at least 1% of your week, which comes out to like 90 minutes. I think, it comes out to about 90 minutes a week of exercise. Whether you are deep into exercise, I've been exercising since I was in my 20s. I was a high school sprinter, fell in love with that. Then I got into bodybuilding in college, and I took 2 titles, Mr. East Coast, Mr. National New Jersey, and I continue to harp on exercise. Now that my kids are exercising, I try to get them into the gym, get my wife into the gym. I'm going to be a personal trainer soon, again with NASM. So hopefully I change my practice of how I practice medicine to include medicine in the gym. That's a big project of mine. I think you can beat the disease. If you can get the disease before it starts, everybody's better off. You don't have to spend as much money, and the government will be not so broke. So hopefully this helps Ray. For all the other folks that are thinking about trying to start exercise, again, don't let age discourage you. And don't let weight discourage you. There's always a way to break into it. But the later you start, the more diseases you'll accumulate, the harder you're going to have to start sooner or later. But the harder it'll be to get that stalled car moving. So invest now and it'll be a little easier later on. But don't forget to subscribe to me. Thanks for watching up until this point. And share this with somebody that's also on the fence. Otherwise, I'll see you next time in the clinic.